Louisiana's lawsuit against opioid manufacturers may be far from over, but state lawmakers are already thinking of ways to spend any settlement dollars we may receive. Capitol correspondent Harrison Golden joins us now to run down what lawmakers and litigators have in mind. Harrison?
Hey, John, that's right. Good evening. Worth note here, there's still no exact timeline of when this lawsuit would end, but meantime, whether Louisiana will be getting any money at all here still remains uncertain as well. Though state leaders are already getting what they call a head start. Their list of priorities today stuck largely to the same premise. They say any money the state wins from more than a dozen drug makers should go toward opioid treatment, education, and prevention, and to the agencies that have spent all too much to address this national crisis.
What we're working on is trying to talk to the agencies to get a feel for where their spend goes, where do they feel the crunch of the opioid crisis.
Louisiana's Assistant Attorney General Stacey W. says from health to corrections, departments across the state have made their case to her that the opioid crisis has cost them.
Not just from strictly a financial sense, not just, LDH and the dollars they spend, but also things like the Children's Services, Department of Education.
These agencies are seeking a slice of whatever settlements arise from the state's lawsuit. Lawmakers with similar demands saying before any dollars come, they want a sense of where that money would go.
I'd hate for us to have a massive opioid settlement and some key resource we need for our citizens be underfunded because we put the money in the wrong part of the settlement and it's just sitting there 20 years later.
One item on the legislative wish list, money for genetic testing, so patients can determine their risks for addiction.
To prevent those, actually predict and prevent those from becoming addicted to the opioid problem that we have.
Others suggested the money also go toward the state's workforce commission.
These folks unfortunately end up missing a lot of work or losing jobs and everything else, so they go on the state support, and I mean, I don't know how you quantify that.
Right.
But it's got to be huge.
It's got to be.
Dollar amounts much needed, say senators, though both they and justice officials admit that any settlement would only scratch the surface of the national crisis.
The reality of this problem is really greater than what's going to show up in your litigation.
Yes.
Now, since 1999, there has been a 300% increase in opioid prescriptions nationwide, and just as of June, more than 600 state and local governments have filed lawsuits related to opioid abuse, and that includes separate litigation from cities and parishes across Louisiana, East Baton Rouge Parish among them. For your local election headquarters, I'm Harrison Golden.